In 2011, New South Wales Health was planning to divest more than 30% of the Royal North Shore Hospital campus. They were about to destroy one of the major teaching hospitals in the country. It was a public health disaster. The old hospital had reached a desperate state of disrepair. The brick cladding on the building had been reinforced with steel bars to prevent bricks from falling on the public. A covered walkway had been fashioned to allow safe entry into the building. Before the new acute services building had been completed, it became clear that its capacity was insufficient. It was too small, and it had not been designed to include the maternity, psychiatric and burn services which were provided for on the campus. Within 2 years, it had been necessary to construct another building to house these essential patient services. This building, the Clinical Services Building, is to be opened this week by the Minister for Health. It is constructed on land that would have been divested in 2011 had it not been for the community's protest. We do not seem to have learnt from this lesson. At the present time, New South Wales Health is proceeding with divestment of land on the southern part of the North Shore campus. This land is adjacent to land that was divested in the 1990s. The funds generated at this time would only have run the hospital for a few months, but the clinical opportunities that it could have provided were lost forever. Rather than being a hospital adjacent to a railway station, it is office space. Successive state governments have felt that they needed to sell our most valuable health assets to developers. The consequences of this has shaken the public's confidence in government to the bone. There is no shortage of real estate opportunities in New South Wales. In particular, in northern Sydney, there is no shortage of office space. However, there is a shortage of real estate that provides easy access to tertiary healthcare services for patients throughout the state. Land that is accessible to members of the community no matter where they live. A hospital that is immediately adjacent to rail infrastructure provides just this. It is of the highest priority that we look after the health of our community, both now and in the future.